Hey guys, on behalf of Group 2, we'd like to welcome you to our presentation for the Gerontology Conference entitled The Unprotected Truth. We're going to take a look at the prevalence, risk factors, and nursing implications of sexually transmitted infections in older adults. Our group was made up of four members: myself, Abigail Aman, Irene Lowry, Lexi Hoyle, and Riley Green. So, diving right into our background, sexually transmitted infections are an increasing problem among older adults, particularly the population of 60 and over. This demographic historically has been overlooked in terms of our public health campaigns and our guidelines that have always focused on the younger adults, and STIs were seen as a problem of the younger adults. Our research shows otherwise, and it also shows that we're leaving our older adults quite vulnerable and undereducated in terms of their risk and their screening for STIs. There's a stigma surrounding sexuality in older ages, and it's a big misunderstanding that's leaving this population at risk and very vulnerable. Older adults are the second largest group affected by STIs. And when you look at the fact that 44% of these patients are Medicare recipients, this can cause a huge burden for our Medicare system. And by the year 2026, about 19% of the population will be over the age of 65. So, this is an issue that we need to address. Sexually transmitted infections are increasing rapidly, but there are things that we can do to help this, and that's by recognizing contributing factors. There are certain age related health issues, such as postmenopausal changes for women, like vaginal dryness, just general immunocompromised state of the older immune system, low condom usage. And this could be because there is a lack of awareness that we need a barrier method to prevent transmission of sexually transmitted disease and not always just necessarily prevent pregnancies since they are at an older age and this is not a concern. Infrequent testing and low risk awareness. And also, a really alarming one is that there's hesitation to discuss sexual health with their older patients. And this is 100% preventable. And this could be an initiative by the nurse, also to the provider, to help better screening for these at risk patients. So, with this issue, nursing is truly in a unique position to be the key for education and to advocate for better screening and support for these patients so that we can promote sexual health for the older adult over the spectrum of their life to ultimately lead to better quality of life. There are currently no best practice guidelines that are in place other than annual testing or more if high risk behaviors exist. And by high risk behaviors, we're talking about new or multiple partners, prior history of STIs, inconsistent condom use, and a potential for a weakened immune system. The CDC recommends that risk based testing is based off of sexual history, not necessarily the patient's age. Sexual counseling is also included, but limited to the setting of care.
When we talk about the history of sexually transmitted infections throughout the older population, it's safe to assume that it's not an issue because they are viewed as a group that is no longer engaging or interested in sexual acts. Stereotypes such as these have made them come across as asexual. It's also assumed that this population of individuals are in established long term relationships, such as marriages, which would lessen their chances of STI exposure. Lack of early surveillance has played a huge role in how STIs are evaluated, managed, and how educational resources are given. STIs have been assumed to only affect young adults or teenagers. Many older adults are not aware of STI prevention and testing, and healthcare providers often overlook or do not address sexual history due to the stigma of sexual activity in older adults, along with not wanting to cause discomfort or awkwardness for the patient. It's also important to note that older adults were excluded from STI prevention campaigns and public health studies before the early 2000s. Knowledge and education deficits. Education is key to understanding and prevention, and most older adults demonstrate poor STI knowledge and limited retention on sexual health information. Due to this lack of information, they do not practice safe sex because they view condoms as a pregnancy preventative instead of an STI prevention. Rise in infection rates. Lack of education also allows older adults to get in a mindset to where they feel that they are not at risk. It's also very common for older men to engage with sex workers, which also increases the risk of STIs, especially if condoms are not used. This is just another example of why education is important to decrease these infection rates and these risks. Recent professional concern: the older generation is now experiencing longer life expectancies. Also, with increased divorce rates and having access to electronic dating sites, STIs are still a rising issue in adults over the age of 65. Along with stigmas and assumptions from healthcare providers when doing assessments, it's still common for them to be underdiagnosed and educated poorly. So, it's important that we make this a priority.
As people age, sexual health often becomes a topic that's overlooked, but the data shows it really shouldn't be. Rates of sexually transmitted infections, including chlamydia, gonorrhea, and syphilis, have more than doubled among older adults over the past decade. What's surprising is that adults older than 65 are now the second highest age group for reported STIs, right behind young adults aged 15 to 24. Research also shows that about two-thirds of adults over 60 remain sexually active, but many don't use protection, often because pregnancy is no longer a concern. A study found that when providers were educated on screening guidelines, STI testing jumped from 2 to 10%, and positivity rates rose from 7 to 8%. That means more cases were identified and treated. Altogether, these numbers remind us that sexual health doesn't retire at 65. Continued education, screening, and open conversations are the key to keeping older adults safe and healthy.
There's a few key risk factors like the increase in the elderly population, leading to the availability of more sexual partners through nursing homes, pickleball, senior centers. A handy Viagra has also done wonders for the population's ability to have sex. But there's a lack of knowledge throughout the population as well, associating the need for protection with pregnancy. This leads to a lack of condom use. Overall, a lack of knowledge surrounding sex, pharmaceutical intervention are our biggest risk factors. But there's medical bias as well, forgoing the idea that our elderly population is having sex, and therefore they're not being screened appropriately. This is very prevalent, not just globally, but in the United States, as we're seeing an increase in adults over 65 with rapid rates of chlamydia, gonorrhea, and syphilis. These adults don't disclose risk factors, and sometimes they don't disclose symptoms. This means that Medicare is not being met for the increased risk criteria to cover the screenings. No screenings equals a perfect STD spreading storm.
As nurses, we're often the first to create a safe space for older adults to talk about sensitive topics like sexual health. Our role goes far beyond just screening. It's about building trust and educating patients using evidence-based guidelines from the CDC. We help reduce stigma by treating sexual health as a normal part of holistic aging, and we collaborate closely with other providers to make sure testing and treatment happen early. It's also important that we stay informed through ongoing education and let patients know that Medicare covers STI screenings and counseling, removing a major barrier to care. Ultimately, our goal is to empower older adults to take charge of their health while maintaining dignity and confidence.
So the nurse does have a unique position because we need to teach our patients that regardless of age, they are at risk for contracting a sexually transmitted disease if they are sexually active. If we discuss their sexual health with them and we normalize these conversations about their sexual health, we will feel more comfortable providing them with comprehensive sexual health. The conversations about safe condom usage, about lubrication, about communicating with their sexual partners will come easier once we have built that rapport with our patient that they are comfortable discussing those things with us. We don't need to avoid any discussions due to things like ageism, or it might be uncomfortable to have these discussions with them because this ultimately will create a barrier to care for our patients. Lack of training, specifically at the level of nursing school curriculums, we need to be sure that we are incorporating comprehensive sexual health in our education of new nurses. And also, when we are out in the community, we need to find ways where we can reach out to patients because a lot of the counseling and comprehensive sexual evaluations that patients are entitled to under Medicare are in with or within the confines of primary health. And we know that our patients are in hospital settings, long term care settings. So we need to be very intentional about our community outreach as nurses. So, best practice guidelines. Medicare focuses on a very limited screening based off episodic counseling on an annual basis. This actually conflicts with the literature that we have found through our research that emphasizes that comprehensive preventions and consistent education should be part of our screening. We shouldn't just limit it to an annual screening because this is a very limited window of time that we have with our patient. It needs to be on an ongoing basis. We need to have sexual health conversations with our patients because these neuro protocols may allow for infections to spread before we are even able to detect them in our patients. Also, the counseling must occur in primary settings. So, this can be a barrier for our patients that are in long term care settings, rehab facilities, hospitals, ambulatory care, because many of our older adults are in senior living facilities. So, we can't really reach those patients and counsel them in a way that Medicare will provide coverage for that. And this creates a gap because they're in a high risk situation like a senior living center where there is access to multiple partners. So we're putting them in a setting where they're more at high risk, but they are less accessible to the counseling and comprehensive resources that they need. So this is a really huge gap for care, and we really need to be intentional moving forward with ensuring that we are providing our patients with adequate education until these protocols are changed at the federal levels.
In closing, the rise in sexually transmitted infections among adults 65 and older is a growing public health issue, but it's one we can change. By breaking down stigma, increasing provider education, and making use of preventative care like Medicare-covered screenings, we can reduce infection rates and promote healthier aging. Sexual health is truly part of the overall wellness, and it deserves the same attention and compassion as any other aspect of care. Open and honest conversations can truly save lives.